common domains in the trial design register. So okay, so the protocol is trial design datasets. We need to read the protocol. As per our understanding, we need to create these datasets. Okay, remember trial design dataset is not a subject level data. It is a trial level data which we can read protocol, and then we should map these domains. Trial design datasets. Okay, the relationship records. Okay, and then this is another category. So the relationship. Okay, so here we can mention that okay, the relationship between the two records or the two domains. Okay, so two or more basically. Okay? So related records, rel-rec, we can call it as a rel-rec. Oh, for example, when we are going to create a rel-rec. Okay, for example, I'll give the one quick example. Okay, you know that any unwanted medical occurrence happened during the clinical trial, we called it as the adverse event. Okay, so during the trial, some 101 subject got that headache. Okay, it's adverse event. For the doctor checked, and then he prescribed some of the medication for, okay, so like it's a combiflamary painkiller for the headache he prescribed. So the subject took that, for example, like, okay, the combiflam, let's assume. So he took that concomitant medication, right? Why? Because during the trial, apart from the test drug, he took any medication, that is the concomitant medication. So it means due to that adverse event, he got one record in the adverse event domain, and then due to that the concomitant medication, he got the one record in the CM domain. Okay, so it means that adverse event, that record, and then concomitant medication, this record is have actually relationship. Why? Because due to that adverse event only he took that medication. Otherwise he won't took that concomitant medication. Because of the adverse event only he took. So it means there is a relationship between this adverse event record and then concomitant medication record. So this is the one of the example in the real-time work. But there are n number of examples will come. So, okay, like we can create a relationship between the two domains. Okay, that we can put it into the rel-rec. Okay, we can call it as a rel-rec. Apart from this, the supplementary qualifiers. Okay, the supplementary qualifiers, we can create each and every domain. We can create the supplementary. For example, we are saying that the demographics, adverse event, exposure, concomitant medication, medical history. These all are the individual domains. For these domains, we can create the supplementary qualifier domain as well. For example, DM, we can create the sub-DM, supplementary qualifier of the demographics. DM, sub-DM, MH, sub-MH, CM, sub-CM, LB, sub-LB, VS, sub-VS. It means we can create supplementary qualifier domain as well. But when we are going to create, we can discuss in detail when it comes to that particular. But I'll just quickly go through that briefly. So, for example, if there are any information captured in the CRF, okay, the data, it is captured in the database, that information will required in the analysis. Means when we required analysis means the ADAM level and the TLF level. So that information required in the analysis, again that information we cannot fit into the existing domain variables. Then we go and create a one QNAM that put it into the supplementary. So these scenario you might confused, I'm sure, Tadima sure, but no worries, we are going to discuss in detail when it comes to that. Okay, but remember, if there are information captured additional in the CRF that will required for your analysis, and then that we cannot right fit into the parental domain, means DM is a parental domain, MH is a parental domain. Okay, that is not right fit into the parental domain, then we go for the supplementary qualifier creation. So how we are going to create supplementary qualifiers, that we will discuss in detail in the further. Okay. Then the study reference. Okay, the study reference domains is a very rarest domains. We use not created, and then it's specific like device identifiers. Okay, for example, as I said, some of the trials will be device level. It's not a test drug. So there we can create the device identifiers, so DA. So some pharmacogenomics or genetic biomarker studies, we can create the PB. Okay, so these are the some study reference domains. Okay, the associate persons. Associate persons is nothing but, okay, so data about the persons associated with the study or subject or device. Okay, so as I said, if it's an infant study, okay, so the newborn babies or just 1 year baby, 6 months baby, there they cannot answer the each and every question. There they cannot sign the informed consent. Obviously they need some associate persons to participate in the study. Obviously, who will be the associate person? Father or mother, right? So that father and mother related information is captured in the study. Obviously they are going to capture that information. We cannot fit into the regular domains. There we can create the associate person domains. For that, for example, it's associate person related demographics, we can put the APDM. APDM is the associate person demographic. Okay, so this is the MH, okay, medical history, associate person medical history, it's the APMH. Remember, a regular domain wise only it will be there. This only one thing is that it will be there the prefix of AP. AP stands for the associate person. Okay, so these are the other classification. As we said, the general observation classes. One is the like interventions, event findings. Apart from this, the special purpose, trial design, relationship, study reference, as well as the associate person. These are the we can get the classification. Okay, so after this class, I'm going to show where we can get the classification in the SDTM-IG. You have to read everyone, and then you should remember that. Okay, what are the classification? Each and every classification, how many domains were there? That you should remember for sure. Okay.
Sir,
Yes.
why should we want other person associated with the subject demographic?
Why should we means, for example, simple. If 6 months baby, 1 year baby can directly go to hospital and then take a medication and come to home.
No.
Obviously, father or mother have to take to the hospital, right?
Yes.
Yeah, if you go in the hospital, that's what the clinical trial is also same thing, right? If the patient wants to enroll 6 months baby, 1 year baby, so 2 years baby can decide that he or she is going to enroll in the this clinical trial.
No, sir. Okay.
No, right?
No. Understood.
Obviously, so for example, this associate person. Yeah, so associate person, why we required some of the vaccination related and all these things, the family history, medical history, and that all also will required. Okay.
Okay.
Okay. For example, I'll give you one scenario. For example, if it's a vaccination study, the newborn baby is going to enroll in the study. So there some of the inclusion exclusion criteria mentioned that. Okay. So like maternal parents, ELISA test should be negative. Means her mother should not diagnosed with the like ELISA test, or I mean basically HIV. Okay, so if a mother is diagnosed with HIV, then that patient's newborn babies cannot enroll into the study. Then obviously the test is going to perform on the mother only, right? So the data, everything is to enter into the database. There we are going to where we are going to map that data. That is the associate person data. We don't have. We don't keep it that into the subject level domains. So obviously we go for the associate person demographics, associate person concern domains based on the data points. Is that clear?
Yes, sir. Thank you, sir.
Great. Is there any other questions from anyone?
Sir, here I have one question. In a relationship, we have only that related records and supplementary qualifiers. Other than that, any relations?
No, here the relationship we have the only rel-rec and then supplementary qualifiers. Supplementary qualifiers is nothing but the we can create supplementary qualifier any one of the domain, as I said, sub DM, sub PEPH, sub LV, sub VS, sub EG, depends. So here we have the only one domain. Rel-rec is the one domain.
Is this compulsory for the supplementary qualifier? Compulsory should be there.
That's what, as I said, if the data is captured in the CRF in the database, that information required for the study, and then that information cannot fit into the existing domain, then we'll go for the respective supplementary.
Okay, fine.
Okay. Okay. So these are the classification we just discussed. Okay. So who is they? Is there anyone in the call from the Stansis staff? ఎవరైనా ఉన్నారా Stansis staff నుండి? SDTM-IG?
Yes, sir.
Okay. So if you can see this SDTM-IG 3.2 version, there is a page number 13. Okay. So if you go in the general observation classes, the section 2.4, there we will have the interventions, events, and then findings. So here they will explain in detail. Go and read. This is very, very important. I am clearly saying that. Okay. So who are the serious? They really want to get a job. So please follow my instructions. It is very, very, very important. You should read each and every aspects. Okay. So yeah, so next, if you go in the next page, okay, this is the like SDTM standard domain models. Okay, as per 3.2 SDTM IG, these are all the domains we have in the SDTM. Sorry, if you can see, so this is the special purpose. There we have the comments, demographics, subject elements, subject visits. These are the 4 domains we have in under special purpose. And in the general observation classes, interventions, events, and findings. If you go in the intervention, we have these 6, 7, 5 domains. Okay, concomitant medication, exposure, procedures, exposure as collected, substance use. Okay, and then the general observation class, events, adverse event, disposition, healthcare and concern, clinical events, protocol deviation, medical history. When it comes to the finding, you can see there's a huge list. So here with the drug accountability, ECG, immunogenicity specimen, microbiology specimen, okay, so morphology, PK concentration, PK examination. So there are a lot, tuber identification, vital signs, and then, so there are a lot of domains, okay. When it comes to the finding about, okay, finding about events or intervention, then skin response, okay. So these 2 are the finding abouts. Okay, and then trial design dataset, as I said, these are the trial design dataset, and the relationship is the supplementary qualifiers and then related records. So everyone, each and everyone, you should know the classification, and then each classification, how many domains were there, you should remember. Okay, if I'll ask what all are the domains comes under event, you should tell these 6 domain names. Okay, if I'll ask that, okay, substance use falls under which domain classification, tell that, okay, it's the interventions. So you should remember all this. Okay, so go and read it once you receive this PDF document. Okay, so now we have discussed about the SDTM, and then in the SDTM the domains classification and how many domains were there in the SDTM. Okay, so these all are the domains we have in the SDTM we just discussed. Okay, these all are the domains. Now each and every domain will have the variables. Okay, just remember the domain is nothing but, okay, we'll have a kind of SAS data set. There what we will have observations and variables. Okay, but in SDTM each and every domain will have a specific variable names. Okay, you have to follow that variable naming convention based on the data points is captured from the database that you are going to map to that variable. So how we are going to do that, we will discuss. But now before that you should remember what is SDTM classification, how many domains were there each and every class. Later, each and every domain, how many variables were there, what is the variable classification. Again, variables also we will have a classification. Okay, so domains classification wise, we have a variable classification also. Who are going to try it with the fresher, then this is a very, very, very useful. They might ask these questions in interview. Okay, like this classification of variables and domains, all this. Sometimes less experienced guys also, they can face this kind of question in interview. Okay, so now we'll move to the variable classifications. Okay, variable classification. Okay, so the variable classification is having the 2 types. One is that based on the role, based on the core. Okay, what is the variable classification based on the role? What is the variable classification based on the role? We should core and role. Okay, so we will discuss. Okay, the role we will have the 5 type of classification. Okay, it means each and every SDTM variable will fall under based on the role these 5 categories. So what all are those? And based on the roles, okay, that variable role based on the role, we will have the 5 classifications. Okay, so that we will discuss in detail now. Okay, so remember based on the role classification, variable roles, identifiers, topic. What happened? Roles, we have the identifiers, topic, timing, qualifiers, and rule variables. Okay, so first of all, okay, we will see that one of the example like how the domain variables will be there. So that we are going to discuss. Okay, anyway, that anyway in the future slides it will come. Okay, so the first one is the identifiers. Okay, identifiers is nothing but its identity, identify the study, subject, domain, and sequence number of records. Okay, so the basically these variable roles are, it will give the identification to someone. I mean something. For example, if you want to give that, okay, how we can identify the human on the what basis? ఎట్లా ఐడెంటిఫై చేస్తాం ఒక పర్సన్ ని?
By the physical appearance.
Not exactly. So what is that identity? For example, if you want to call someone, how you will call?
Name.
Obviously by name, right? Name is identifier. Okay. So the likewise in the clinical trial, when it comes to the identifiers, it might be the study ID. Study ID is the main. For example, ABC123 is the study name. Let's assume. So that is the identifier. It will give the identification of the study, right? For example, subject ID 001, 002, 003 is the subject is the identifier of the subject. Remember, nowhere will capture the subject names in the study. So they will have the one unique identifier number, like, okay, that is like subject numbers 1, 2, 3, like that. They'll get that 001, 002, 1000, 1002, something like that. Okay, and then site ID. So these all are variables comes under identifiers. Okay, so these are the some common examples for the identifier variables. The next topic variable. Okay, remember, topic variable is the important variable. Each and every domain will have only one topic variable. Okay, so if you go to the demographic domain, we'll have only one topic variable, that is subj ID. In the demographics, what is the key information? Subject identity. That is the subj ID. That's why it is a topic variable. Okay, so when it comes to the adverse event, what is the key information? When it comes to the adverse event domain, what is the key information?
Adverse effect.
Sorry? Fever. This is the adverse event name. Okay, so that is nothing but the term, adverse event term. AE term is the topic variable. Okay, so the remember, topic variable will give that, okay, the specific focus on the observation, that particular observation. Example, name of the lab tests or name of the medications. Okay, for example, name of the medication. For example, when it comes to the concomitant medication, what is that identification? Drug name. Okay, Combiflam is a drug name, Dolo is the drug name. So that is the key information for the particular domain. Okay, that is a topic variable. Okay, so each and every domain will have only one topic variable. Remember, the all other classification will have the multiple variables, but when it comes to the topic variable, we'll have only one variable for the each and every domain. Okay, so the timing variables is obviously, it's a very commonly you can identify that. Okay, start dates and end dates. For example, when it comes to the adverse event when it was started. So AE, ST, DTC, adverse event start date. When it was ended, AE, EN, DTC, adverse event end date. Okay, for example, demographics when it was collected. So the collection of the demographic date, DM, DTC. So for example, exposure, when the subject took that medication, EX, ST, DTC, exposure start date. So likewise, all date and timing variable will comes under the timing. Date related, time related variables all comes under timing timing variables. Okay, the next is the qualifiers. The qualifiers is nothing but it will qualify the something. For example, further describes the result or additional traits of the observation. Okay, it will qualify something. For example, it's a units and then position. Okay, for example, units. Okay, we'll go for that vital signs. Okay, why in the vital signs? Okay, what we will get, that what is height, weight, okay, BMI, BSA, temperature, pulse, versus BP, diabetes. Okay, so generally common. Okay, BP, what will get that common 120/80. Okay, let's assume. Okay, height means we'll get that. Weight, for example, in the weight we'll get that 60. What is 60? what is 60?
kg.
60 kg, for example. But when it comes to the some regions of, let's assume India we will weight in the kg units. But when it comes to the European region, they will calculate lbs. Okay, so for example, sometimes height into the inches, centimeters. Okay, it depends. Means if you didn't mention that unit, it will not qualify something, right? 60. What is 60? If you mention that 60 kg, then only it will qualify that value, right? So here the units are the qualifiers for the particular results. Yes or no? So that's why position also, for example, for example, VSPOS is the variable position where it was taken, vital signs. Okay, so which position means, for example, if it's a born babies, okay, the vital signs will very commonly captured in the two positions, supine and standing. Okay, so these two are the positions they are going to capture. So it means this to qualify the particular observation. So that's why we can call it as a qualifiers. And the rule variables is these variables based on the some particular rules we are going to do. For example, algorithms are the executable method define that the start and end of the looping condition trial design. So for example, when it comes to the trial design, we'll have the trial element, TE domain. Okay, so the trial element, TE domain, okay, element is nothing but it's a building block of clinical trial. Let's assume that it's a building block of clinical trial. Okay, so there we can say that we will have the which element is going to start when, which element is going to start when, and which element is going to end when. So it means for the element start rule, element end rule will be there. Means TESTRL, TENRL. Trial element start rule, trial element end rule. So these are the one of the example for the rule variables. Okay, these variables will be defined based on the some specific rule. Okay, so the variable role classification, you will have the 5 variables: identifiers, topic, timing, qualifier, rule. Everyone should remember these 5 variable classification. Each and every variable you should observe that which classification it will be fall. Okay, is that clear, everyone? Do you have any questions?
Sir, in timings, it will show only first visit or multiple time of visits we can able to see.
The timing variables is that, okay, any variable is capture date and time, and this will be comes under the timing variable. Okay, so we'll have the all date variable comes under timing variable. So that's it. You should remember that it. So how many times it is going to capture depend on the study requirement. Okay, we'll have the multiple visits means multiple times it is going to capture.
Okay. Thank you.
Okay. So then the variables within the general observation classes. So all 3 general observation classes share the identifiers, timing, variables. So now we have discussed. Okay. Still there were someone want to join the class. Okay. So previously we discussed the general observation class, events, interventions and findings. So there we will go and discuss one by one variable, which class. Topic and the qualifier variables are unique to each other observation class and are not same on the across. Okay, so these qualifiers and topic variables will be different from the each domain. So for example, there are some specific domain variables are for use only the specific domains in the identified the appropriate implementation guide. Okay, so there are few domains will have the specific domain variable convention, naming convention. So what all are those we are going to discuss in detail. So for example, we said that based on the variable role classification, based on the data points, how we can identify variables, we will see that. Okay, for example, so the variables in the general observation class in interventions. Okay, so in intervention, what I said, what we are going to capture in the intervention data?
what kind of treatment they are giving.
Right. So what kind of treatment and also if you can see this, okay. So here we can get that structure of the domain is a one record per constant dosing interval or intervention episodes. Okay. If you can see here, we want to know the following of the treatment administered. Okay. For example, when it comes to the intervention, these are the key informations. Okay. For example, name of the treatment. So what is the name of the treatment? That is a topic variable and then that starts with the TRT. So it is the name of the treatment is the variable name should be in the SDTM level. It's a TRT. These two are the domain variable. For example, if it's a CM domain, CMTRT. If it's a EX, EXTRT. If it's a EC, ECTRT. So these name of the treatment comes under the TRT. So this is a topic variable. Okay. So what we have discussed, the 5 classification. What all are those 5 classification? Did anyone remember what we have seen in the previous slide?
Identifiers, topic variable,
Variable, timing
variables, qualifier variables.
Great. Yeah, that's correct. So there, this is the topic variable for the interventions. If now tell me, what is the topic variable in interventions? You should say the TRT. So TRT is the common name, but when it goes for the specific name, when it comes to the CM, it's a CMTRT. When it comes to the EX, EXTRT. So, but you should remember in intervention, topic variable is the TRT. Then the standard name. Standard name is nothing but that particular drug name. As per the drug dictionaries, every drug will have a specific standard name that comes from the dictionaries. Okay, but that is the standard name. Within the same of the drug will have another name. So that is the D code, CMD code. Okay, so the CMD code is the variable. This is the synonym qualifier. Okay, so the remember we missed any slide, previous slide, just a moment. No, actually, oh yeah, one slide we missed. Okay, so basically first what we discussed, okay, before moving to that, the qualifiers are again 5 more types. So the first, based on the rules, five variables are identifiers, topic, timing, qualifier, rule. But qualifiers reclassified again into 5 more types. Okay, so that is the grouping qualifier, result qualifier, synonym qualifier, record qualifier, variable qualifier. Okay, so the qualifiers has reclassified again 5 more types: grouping, result, synonym, record, variable. Okay, so the grouping means the name itself is having that it is grouping the things. For example, categories, subcategories. Okay, so let's assume that LB category, LB subcategory. Okay, so in the n number of tests will be there. What kind of test? It is a like hematology, all blood samples will come under hematology. Chemistry, urine analysis, pregnancy test. These all are categories in the laboratory, right? So it means these category, subcategory variables comes under the grouping qualifiers. Result name itself, it will contain the result. For example, if you go and give any test, that will get that result, right? So the result is nothing but the ORRES. It's a original results. Okay, STRESC. It is the standard results character versions. Okay, so the ORRES is nothing but it's a result name. If it comes to the LB ORRES. Okay, no worries. These variables we will discuss domain by domain further classes. We'll start from the demographic. We'll discuss all the classes variable names and the naming convention. What kind of data we are going to map in that variables we are going to discuss in detail. Okay, just remember for the basics now. Initially when you listen first time, you feel that okay, I mean to catch the things it would be really difficult, but when you start reading the SDTM-IG or listening the 5-6 classes or 10 classes, okay, then you will be on the flow. Okay. So now the synonym qualifiers. So the synonym qualifiers is naming itself will have this. So what is synonym? In general definition. The same meaningful other word, right? Yeah. So the basically in SDTM variables also there are few variables. It will qualify the variable with another variable. That's the alternate name of the particular variable. For example, modify, decode. Decode, for example, it's a term is the decode value. For example, CM decode is that the CM term. CM term is CMTRT. CMTRT is the topic variable. Okay. So the CM modify. I mean, this is the same treatment. Another name will have the CM modify. For example, here the decode. Decode is that, okay. Again, we have the term adverse event. AE term is the topic variable. For that, AE decode is the synonym qualifier of the AE term. Okay. So it means the modifier and decode, there are few variables, it will give the same information with another name. So that we can call it as the alternative name, the synonym qualifiers. Then the record level qualifiers, okay, these values, it will contain the entire record, okay. For example, position, location, specimen. Position is nothing but, okay, as I said in the vital signs position, VSPOS variable. So it will qualify supine position, standing position, how the vital signs were captured. So it will qualify the entire record, right? For example, location. Location is nothing but which body of the part, arm, thigh, forehead, wherever that was test work done or whatever it may be, assessment done in the which part of human body, that a location is going to capture the LOC. Okay, these two are the domain prefix. Specimen, for example, when it comes to the LB, okay, specimen condition, okay, for example, isoprite or hemolyzed, there will be different conditions in the specimen, right? LB spec. So it means this will qualify the entire record. So that's why it is the record qualifiers. Then the variable qualifiers. So variable qualifiers is a simple example. As I said, the result units, okay, as I said previously, okay, height 173. What is the 173? 173 centimeter. When it comes to the cm units, it will be meaningful. So the weight 60. What is 60? 60 kg. It's a meaningful. So then the LB VS or ESU. I mean, whenever it's a units that will comes for that, or ESC is the or ESU. For the result, units is the variable qualifier. For the dose units is the variable qualifier. Okay. So these are the 5 again reclassified qualifier variable. Okay, so the first based on the rules 5 types. There the qualifiers reclassified again 5 more type: grouping, result, synonym, record, and the variable. Okay, so is that clear?
Yes, sir.
Okay, so I will show you in the here. I think is pretty magic. Before the domain classification, we'll have variable classification, I guess. Yeah. So the second chapter, fundamentals of SDTM, you go and read it. Okay. So these are the variable classifications. Okay, if you can see this: identifier variable, topic variable, timing variable, qualifier variables, rule variables. These qualifiers again reclassified into 5 more type: grouping qualifiers, result qualifiers, synonym qualifiers, record qualifiers, variable qualifiers, with the example what we have discussed now. So this is under page number 11. Okay, so you go through these for sure. Okay, so yeah. So okay, with the data wise, what kind of data class is it? Okay, when it comes to the intervention, as I said, it's a treatment related information. Name of the treatment is the TRT. TRT is the topic variable of the particular domain. Okay, interventions. Standard name is nothing but the decode. So that is the synonym qualifier. Why? Because for the decode is the TRT synonym qualifier. So how much was taken? What is this? How much was taken means?
Medicine dosage.
Dose, right? Dose variable. Okay, so this is the EX dose, CM dose, depends on the variable. So the dose is nothing but the record qualifier. It will qualify the record. Okay, so then again, dose units, dose frequency, dose form. Dose unit means how much means it's for example 200. What is 200? 200 mg.
200.
Mg. Dose units is the mg. Frequency, how many times he took that? If you go in the hospital, doctor prescribe that, okay, morning once, evening once, or the daily twice, daily thrice, weekly once. Based on the requirement, he will prescribe the medication. SOS. SOS means as and when needed. Okay, some painkillers they will write SOS. SOS means if the subject got the pain, then only he took that painkiller. Otherwise, it's not required. So it depends on the particular disease and the condition, patient condition, doctor will prescribe. Okay, so that is the frequency. Dose form. What is dose form? The tablet is in the the drug is in the which form? This is a tablet or emulsion or injection or strip or the like we can say some kind of patch. Nowadays some of the painkillers will have in the patch also. So wherever which part of your body are getting the pain, you can stick that patch that will work as a local painkiller. Okay, so no need to take some kind of painkiller tablets. It depends. Okay, so what is the form of the particular dose that comes under? So these variables all are variable qualifiers for the dose. Okay, so then the timing variables are example if you comes to the interventions. Okay, STDTC, ENDTC. When it comes to the EX, STDTC, EX, ENDTC. These are the timing variables, right? So classification is the timing. So when it comes to the events, what is the events?
Adverse event, serious adverse events.
Right, something happened to the subject. Okay, if you can say, when it comes to the events, what we will ask, what happened? Means name of the adverse event. That is term. Okay, so it will come. What is this variable? What classification it will fall? We have discussed.
Identify.
No, name of the adverse event will fall into 8.
Confirm.
This is the key information for the events, right? The key information will fall under which variable classification? What kind of variable is this 8? Huh?
Topic variable.
Exactly, yeah, topic variable. This is the key information, right? This is the topic variable for it means in the previous intervention, what is the topic variable? TRT, right? But when it comes to the events, it is a term. TERM term is the topic variable in the events. Standard name, again, it's a decode value. What is this classification? Decode is a
Synonym qualifier.
Exactly, synonym qualifier. Timing variables is nothing but the AE, STDTC, AE and DTC. Okay, these all are timing qualifiers. Next, how serious is this? Okay, something has happened to the subject and subject said that, okay, I am getting fever. How much serious is this? Okay, SCR variable, is this serious or not? AE, SCR variable name. So that is the record qualifier. Then what was the cause? What is the reason? So that is the relationship. Okay, so that is again it's a record qualifier. Okay, so is that clear? Yeah, so when it comes to the findings, okay, findings, as I said, it's a test CD related things. Okay, so when it comes to the finding domain, what is the key information? Test name. What was the examination done? Okay, so what we are saying this RBC, WBC, pregnancy test, urine analysis, pH, whatever the test they will done. The test name is the key information for the findings. So what was done on that is the test name. That is the test. Each and every test. Sorry.
That is a topic variable.
Yeah, so the test is the test name. Each and every test name will have the one short form of the test CD, for example. Okay, so and then what was the examination done? Again, it's a category also. Category why? Because in the each and every test will have. When it comes to the LB, as I said, it's hematology, chemistry, urine analysis, pregnancy test. These are the categories. This is the grouping qualifier. Category is the grouping qualifier. Remember. And then test CD. As I said, the test name is the short form of the test CD. For example, in the vital signs, systolic blood pressure, SysBP is the test CD name, the short form of the test. Diastolic blood pressure, DIBP is the short form of the test. Temperature test, TEMP, temp is the short form of that particular, which means test CD is the temp. So it means when it comes to the finding domain, test CD is the key information. So that should be a topic variable. Okay. So the next test also, test is nothing but the short form of the test will have the full name. What will be there? I mean, if the test seed is the topic variable, test is that what variable? Synonym call. Why? Because the same information it comes here, right? Yeah. The timing again. So the DTC. So method and position also, as I said in the method and position also will be there. These are the record qualifiers if you remember. Okay. So then the timing qualifiers, timing variables are that visit, DTC, time points. These all are the timing variables. Okay. And then result, ORRES, STRES and STRESC, okay. Original results, standard results, numeric version, standard result, character version, these variables, okay. So, but no worries, this variable convention you might miss, okay, here, but I will explain in detail one by one domain, then you can find that, okay. So the result qualifier, these all are the result qualifiers, okay. So it means if you can see the each and every domain will have the specific variables. Each and every variable will falls under the one of the domain class, variable classification, right? So the ORRESU, the STRESU, I mean results for the original results and the standard results. These are the variable qualifiers. Why? Because qualify the particular variable. Okay. So then, yeah, we can stop it here. So we'll discuss from